I'd like to welcome you to this very special examination. We are going to be working with 3 of the 4 major manual diagnostic techniques. We are going to start with palpation, which for some is their favorite part of an examination. From there, we will go to percussion and then auscultation. Now, at the end, there is one area of the body where the order of these techniques is changed up a little. So we'll get a little bit of a reprise at the end. So to start, I am going to be working with your face and your head and work down the body from there. For this examination, I will need to be touching you. Is that okay with you? Do I have your permission to do that? Wonderful. If at any point you feel any pain or discomfort, please let me know. So I'm going to start with the head and the scalp. So with the head, we are looking for a number of things. Now, I am feeling firstly the contours of the skull. And there are quite a few bones in here. We're not going to go over all of them, but some of our major ones. So at the very top here, you have the parietal bone over the parietal lobe of the brain. We have the frontal here with the frontal lobe. We have the temporal back in here, right back here, and if we come anterior to that, then we get the sphenoid. So where your temples are at here, that is the sphenoid bone. And at the very back, this is the occipital bone. And then at the base of the skull, you have the occiput. And then we get down into the spine, the vertebrae, starting with C1, or the first cervical vertebra, and then working down. But we are just focusing right now on the contours. So are there ridges where there should be, depressions where there should be? Just mapping the topographical makeup of your head with my fingers. All the way back, so right in here. We have the mastoid process behind the ear. This is the post-auricular area. Post meaning behind. Many of these anatomical terms are in Latin. If they're not in Latin, they're probably in Greek. I particularly favor Latin, but that's just more because I have a better understanding of Latin than of Greek. Good. So we also have quite a few muscles here. We'll talk about them a little bit more when we come to the face. So while I'm here, I'm going to palpate the occipital lymph nodes And these are around the occiput. Generally, they're in the hairline area. And then we have post-auricular. You remember that is behind the ear. And pre-auricular here. This is in front of the ear. Like a prefix, something that goes in front. And then underneath the jaw, we have submental and submandibular. And then along the neck. And then if we come down, we have the supraclavicular lymph nodes. And these are above the clavicle. So it is superior to the clavicle, it's above. Supraclavicular. Good. So, let's take a look at the face. So I'm just going to have a little look. Actually doing a bit of inspection here. It's not one of the diagnostic techniques we're focusing on, because that is something I do while I'm palpating. But just like to have a little look here. So we have the frontal bone here and the frontalis muscle. Right in this area of the forehead, we have the orbital bone right around the eyes, the orbital ridge. And one of your major muscles here being orbicularis oculi. Have the nose here, so you have, for example, the ethmoid bone down in here, and that's where we get the term for the sinuses in this area. Those are the ethmoid sinuses. And then the cheekbones. This is the zygomatic bone, the zygomatic arch, and our muscles here are zygomaticus major, zygomaticus minor in here. And of course we have the mouth here, so your big muscle right here. This is orbicularis oris, like the spherical muscles around the eyes. There is one around the mouth. Good. And then we have temporalis right here, one of your major muscles involved in mastication, the biggest being the masseter here. And with the masseter we have the DMJ right underneath temporomandibular joint. Temporomandibular joint gives quite a few people some issues there. So because these muscles are so strong, because this joint is so strong, when something gets a little goofy, it can cause quite a few problems. A lot of times that stuff can radiate. You get the masseter, then you get the temporalis, and then you can get that elsewhere in the head too. So we have the maxilla, which is the top jawbone. And it's never really occurred to me, but even though you have a top jaw and a lower jaw, only one of those move, right? This one is static, whereas the mandible is a little more dynamic. This one is stationary here, and this one is always moving, always doing something. So then we can get a little bit underneath the jaw here. So we have the hyoid bone here. This is a very important bone. And this is involved in movements that assist our throat and our voice. So if we have muscles above the hyoid, these are the suprahyoid muscles, quite a few of those. And if they are below, right in here, then these are the infrahyoid muscles. And we'll get more into the neck. But right now we're focused on the face. So I am going to use a firmer palpation along the frontal sinus cavities, the ethmoid, and the maxillary here. You could just let me know if it feels painful or tender at all. So we're just going to press. Good. Excellent. Good. Now the ethmoid. Good. Press these. Anything there? Good. And now along the maxillary. Good. So that all felt normal. Very good. Just wanted to double check. So I am going to palpate around the orbital ridge. Let me know if any of this is tender. Let's see here. So we've gotten temporalis here, the masseter, gotten our lymph nodes, so let's go ahead and move down to the neck. So, the neck here, we have the trachea. This might be a bit uncomfortable, but I'm going to palpate the trachea just to make sure it is midline, that there is no deviation. we have the thyroid. So I'm going to have you take a dry swallow for me. This might be a little difficult, but if you could just swallow just like that. Very good. Good. And we have quite a few strong muscles here. Our biggest muscle is the sternocleidomastoid. And this one, when you see people moving their neck, it's the most prominent. We also have the levator scapulae. So we have levator scapula here, levator scapula here, two together, levator scapulae. So these are posterior to the SCM and anterior to the trapezius. So anterior means front, posterior means behind. Anterior and pre are both in front, and we've already seen post or posterior. Also referring to the back is dorsal or dorsum. So if I were to come down into the supraclavicular fossa, which a fossa is a depression. So the little valley above the clavicle, if I were to come in here and I were to palpate the superior angle of the scapula and take that and go upwards and about this angle, so it's across the transverse processes of the spine, that would be levator scapula. And then we can also take a look at the posterior neck. So from the occiput, the back of the head. When I come off the occiput, the first palpable vertebra is going to be C2, second cervical vertebra. And then from there, we'll be able to just work down the neck. C3, C4, C5, all the way down to the first thoracic vertebra, T1, at the base of the neck, top of the back. It's very prominent. Then we can get into the trapezius, the trapezoidal shaped muscle that comes behind the shoulders and down the back. And I'm not going to get too far here, but we have the rhomboids, for example, between the shoulders, or the scapulae rather, and then we have the infraspinatus and supraspinatus muscles if we track those along the scapulae. But we're going to remain up here with the upper fibers of the trapezius. And then we come into the chest. So our major muscles here, pectoralis is major. We do have pec minor as well. It's the smaller pectoralis muscle. And we have the clavicles here. We come across most lateral point, we have the acromioclavicular joint right in here. If we come back and down, we have the sternum made of 3 bones. You have the manubrium, the sternum, and the xiphoid process. And xiphoid process is my favorite. I love an XI. Love an XI right in the front there. And then, of course, we have the rib cage. All our ribs here attached and then floating. This is where we get into some of our fun organs we'll be working with the percussion and auscultation. You have the heart, of course, the lungs, and I'm not going to palpate around the abdomen. Of course, we have the stomach, liver, small intestine, large intestine, etc. And then, if we come over here, our shoulder is anatomically called the glenohumeral joint. And here we have the deltoid, we have biceps, triceps, and there's a little muscle behind the elbow and superior to it called the anconeus. In the forearm we have brachioradialis, a lot of extensors, a lot of flexors, lots of longus and brevis muscles, which mean long and short, respectively. And we have the hand and the fingers. So, in the hand, we have, for example, the thenar and hypothenar muscles, extensors, flexors, palmaris, lots and lots of things. In terms of bones, we have the humerus bone. That is our long bone of the upper arm. And on the lower arm, we have the ulna and radius. So, your radial bone is on the thumb side. Your ulna is on the pinky side. And you have the median, radial, and ulnar nerves, for example. And when these get goofed up, they can result in some pretty wacky sensations. Not very fun. So with all of these, I'm focusing first on your right arm. Around the elbow, we have the cubital fossa, which is the depression in the crook of the elbow. Get into the meat of the arm. So I'm also doing my inspection, looking for skin abnormalities, abnormalities with the nails, spotting, ridges, cholesterol deposits, and palpating the joints of each finger. Let me know if this is painful or tender. Okay, and as you hold your hand together, I'm just going to squeeze it. How is that? Not too bad. That's good. Good. And also making sure the temperature of the limb on the joints, on the skin, is warm and dry. Come over here. And the muscles we're looking at, wasting, atrophy. And if I just hold up your elbow here, I'm looking for plaques on the underside of the arm. Is any of this painful or tender as I'm palpating? Okay. Let's take a look at your fingers. So looking at wasting in your thenar and hypothenar muscles. And palpating each of our joints here. Okay, and I'm going to squeeze your hand together. How's that? Good. Very good. So, I'm going to do some palpation on the chest here. Most notably, I am going to feel for heaves, thrills, and the apex beat of the heart. So, heaves and thrills. You feel for heaves with the heel of the hand. Good. And I have the flats of the fingers. Good. And these are palpable heart murmurs, these. Good. And then the apex beat is at the mid-clavicular line. So if we have the clavicle here, the middle of that, and the fifth intercostal space down, which are the muscles between the ribs. If I come to the sternum here, and I go 1, and match up the 2. Where my fingers meet, that should be the apex beat. So from the chest, we're going to come down to the legs here and palpate. So we have big muscles like the quadriceps, you have your abductors and adductors. So in Latin, the word ab means from. The word ad means to. So abductors go from the middle. Adductors come back towards the middle. You have your iliotibial band. It's the big band outside the leg. You have the femur being the biggest bone in the leg. The patella, which means plate in Latin. The tibia and fibula, which I always thought it was a shame that these do not rhyme. They're almost a slant rhyme, but they don't rhyme. That's at the lower leg. And we have the foot with its tarsals, metatarsals, and phalanges, as opposed to the carpals, metacarpals, and phalanges. Good. We're just going to give these a good once over. Feel the temperature. Look at the skin. Feel for wasting, tender spots. Swelling is a big one here. We have to look for pitting edema in the ankles. Good. So let's move on to percussion. We did quite a bit of palpation. Percussion's a little shorter because we will be doing some direct percussion on the sinuses and indirect percussion on the chest. So I'm going to all along the frontal, ethmoid, and maxillary sinuses. Let me know if this is painful or tender. Anything there? No. Good. So for the chest wall, I'm going to focus on the anterior portion. So we're going to start above the clavicle. We have supraclavicular. And we'll just go ahead and I'm going to use my hand and tap on my hand here. Good. Just like that. And then infraclavicular. And along the chest wall. And it should get lower as we go down. Good. And if you could just raise your arms so that I can get at the axilla. And try that one again. There we go. So with percussion, we look for resonance, hyperresonance, a dullness or a stony dullness for the sounds that come back. So I'm going to grab my stethoscope and we are going to auscultate all the areas we just percussed and then get into the heart. We have above the clavicle. Just breathe normally here. If you could take a deep breath in and out. Deep breath in. Deep breath in and out. 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 Deep breath in. And if you could lift up your arms. Good. Deep breath in. And out. Deep breath in. And out. Good. So this is the diaphragm of the stethoscope. I'm going to listen with the bell of the stethoscope. The diaphragm hears higher pitch sounds better. The bell hears lower pitch sounds better. So while you still have your arms up, I'm just going to take another listen here. You can just take a deep breath in and out. Deep breath in and out. Good. And you can put your arms down. Deep breath in and out. Deep breath in and out. out. Deep breath in and 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 out. Right. Let's bring it back to the diaphragm. And this time just breathe normally. And I'm going to listen to the aortic area of the heart to start. Good. The aortic valve. The pulmonary area, pulmonary valve, pulmonary vein. And the tricuspid valve here. Good. And the mitral. I find it so fascinating that the sounds we're hearing are the valves opening and closing. And that's something. And we do have the apex beat here, which we had mapped earlier. Good. And we'll switch to the bell. We have the aortic area. Good. And pulmonary. Tricuspid. Mitral. And the apex beat. Good. So I am not going to take out the stethoscope yet. We are going to circle back to the abdomen because we start with auscultation. Then we can get into percussion and palpation. So, you don't need to breathe deeply. You can just breathe normally here. And only listen for a couple of seconds in each area. But I do a lot more listening. And we're going to put that away. And we'll come back to percussion. So percussion is used to determine if an area has fluid or more air in it. It can also be used to map out the borders of the organs. So there's going to be quite a bit of percussion here. Good. Here we go. Now to finish, we are going to use our palpation. I'm going to start with a firm pressure, then we'll work with a deep. The firm pressure only uses one hand here. This might be a touch uncomfortable. The deep can be uncomfortable, certainly, but I'm going to guide you through some breathing with that. It helps to focus on something different when someone's really digging into your abdomen. Is any of this painful or tender at all? Good. Okay, now for the deep, I'm going to use 2 hands. So if I could have you take a deep breath in and out. Good. Deep breath in and out. Deep breath in and out. There we go. Just takes 3 deep breaths and then we're done. So, was there any pain or tenderness in that other than just the general unpleasantness of having your abdomen dug into? Okay, wonderful. So that will conclude our palpation, percussion, and auscultation, and percussion and palpation exam. I'd like to thank you so much for your participation. You are an absolutely lovely patient. I hope you have a whale of a day and a good rest of your night. Thank you. Goodbye now.
Thank you so much for watching. I really appreciate it. If you enjoyed this video, it would greatly help me out if you clicked the like button and left a comment so YouTube's algorithm registers that it was a good video. If you want to see more of my work, consider subscribing to the channel. I create primarily medical, pseudoscience / alternative medicine, and personal attention ASMR roleplays. But I've done a little bit of everything from historical to sci-fi to fantasy. If you'd like to support the channel, I offer ad-free videos, early access on videos, and exclusive content on Patreon. Or I also have a Ko-Fi link for a one-time donation or a throne wish list for props and equipment. Thank you again, and I hope you have a whale of a day and a good rest of your